Hello everyone, I'm Dr. Anubha Pandey. I'm consultant radiologist and director at Radiology Interventions Private Limited in Varanasi. I've been practicing radiology for last 10 years and today I'm going to share a presentation on pancreas division with you with the hope that after watching this video you would be more confident in diagnosing this entity in future. So the first question which comes in our mind is what is the pancreas division? The pancreas division is a congenital anomaly of the pancreatic duct and it is the commonest cause of a recurrent pancreatitis in young adults. And MRCP is the gold standard imaging modality for diagnosing this entity, and if it is diagnosed correctly, it can be treated by the papillotomy or stenting through the minor papilla. So before understanding the anomaly, first I'm coming to the normal anatomy of the pancreatic duct. In a normal pancreas, there is two ducts, the dorsal pancreatic duct and the ventral pancreatic duct. Dorsal pancreatic duct drains the tail and body of the pancreas, ventral duct drains the uncinate process. In a normal individual, the dorsal pancreatic duct joins the ventral duct to form a common channel and which further joins the distal end of the CBD to open into the duodenum through the major papilla. The rudimentary segment of the dorsal duct opens via the minor papilla into the second part of the duodenum. The minor papilla has a narrower orifice than the major papilla and it is situated cranial to the major papilla in the second part of the duodenum. As MRCP is the modality of choice, that's why I am sharing this image of MRCP in a normal individual just to show the anatomy. This is the slender T2 hyperintensive structure, which is the dorsal pancreatic duct, which joins the ventral duct to form a common channel and which further joins the CBD to open into the second part of the duodenum through the major papilla. Next is this is the video to share the normal anatomy of the pancreaticobiliary system. Here we can see as we go slowly. Here we can see anteriorly this is the T2 hyperintense structure, that is the PD pancreatic dorsal pancreatic duct, and posteriorly there is the CBD. And as we go down, we can see the dorsal pancreatic duct is joining the ventral pancreatic duct to form a common channel, and then it further joins the CBD to open into the second part of the duodenum. So what happens in the pancreas division? In pancreas division, it occurs when there is a failure of fusion of the dorsal and the ventral duct. So the most of the pancreatic juice of the body and tail region drains via the dorsal duct through the minor papilla, and it creates a back pressure changes which leads to the recurrent pancreatitis in some individuals. It has three types. The type 1 is a classical one and the commonest one. In this, there is a total non-union of the ventral and the dorsal duct. Here we can see cranially there is a dorsal pancreatic duct which is draining via the minor papilla into the second part of the duodenum, and this is the ventral duct which is joining the CBD to open into the major papilla. In type 2, there is complete absence of the ventral duct. There is only dorsal duct which drains via the minor papilla and CBD opens separately into the major papilla. In type 3, it is also called as incomplete division because there is a rudimentary communication between the ventral and the dorsal duct. Here there is three key points that should be remembered, that in pancreas division, the dorsal pancreatic duct courses anterior to the CBD and it doesn't join the CBD, and it opens cranial to the CBD into the duodenum through the minor papilla. If you remember these three key points, then you would never miss the diagnosis of the pancreas division. This is the case one, that a 40-year female who presented with the multiple episodes of pancreatitis in the last 4 to 5 years, and gastrosurgeon sent her to our center to rule out the pancreas divisum. This is the axial T2 weighted images with 3 mm thickness. Here we can see anteriorly a small rounded structure, that is the dorsal pancreatic duct, and posteriorly this is the CBD. In a caudal sections, we can see anteriorly there is two rounded structure, that is designating the linear course of the pancreatic duct before opening into the minor papilla. The posteriorly CBD, that is passing ventrally downward further to open into the major papilla. This is another caudal image showing the opening of the minor dorsal duct into the minor papilla, and CBD is still going downwards to open into the major papilla. This is the video in axial sections. It has been acquired in the caudal to cranial direction, just to show you the anatomy in a better way. As we go slowly, here we can see the second part of the duodenum and the opening of here is the opening of the CBD. Here is the opening of the CBD into the second part of the duodenum, and the dorsal duct is coursing anterior to the CBD. It's not joining the CBD, and it's opening separately into the CBD, into the duodenum through the minor papilla. It's open into the minor papilla cranial to the opening of the CBD. This is another video of a 3D MRCP image. Here we can see the dorsal pancreatic duct, which is coursing anterior to the CBD, going cranially to open into the duodenum, and this is the CBD, which is going further down to open into the major papilla. Opening of the pancreatic duct is above in through the minor papilla into the duodenum, and the opening of the CBD is caudal to the opening of the MPD through the major papilla into the second part of the duodenum. This is case number 2. With she was a female of 28 year, and we can see the similar images equivalent to the previous one. Here we can see the linear transverse structure, that is the dorsal pancreatic duct, which is opening into the minor papilla, and posteriorly this is the CBD, which is coursing further downwards to open into the major papilla. Here we can see the dorsal duct is traversing anterior to the CBD. It's not joining the CBD, and it's opening cranial to the CBD. This is the MRCP image. Here we can see the dorsal pancreatic duct, which is coursing anterior to the CBD and not joining the CBD, and opening into the duodenum through the minor papilla, and here the ventral duct, which is joining the CBD to open into the second part of the duodenum through the major papilla. So here we can see all the 3 points. Dorsal pancreatic duct coursing the anterior to the CBD, it's not joining the CBD, and it's opening cranial to the CBD. Although the MRCP is the modality of choice for diagnosing the pancreas divisum, but if you have a multi-detector CT scanner and you give a little more focus and concentration to the pancreaticobiliary anatomy in a CT scan images, you can easily diagnose the PD on pancreas divisum on MDCT. Here in this image we can see the linear structure, hypodense structure. There is the dorsal pancreatic duct, and posteriorly this is the CBD, and this is the video. Here we can see the dorsal pancreatic duct, which is coursing anterior to the CBD, not joining the CBD, and open cranially, and this is the ventral duct, which joins the CBD to open into the major papilla. Thanks for watching. I hope this video would help you in diagnosing the pancreas division with more confidence and accuracy in future. Thank you.